Welcome back to one more session on lean in RCM. Okay, how to improve the denial through the lean process. As a part of today's discussion, we are going to cover how we are going to control or monitor our denial related to frequency denial. Right. So if you consider the frequency denial, this very peculiar denial. If you didn't understand the logic of the billing, then you will get this kind of denial. See, when you get a denial for a frequency, let me share what is the denial code. Okay, if you, for example, 150 and 151, these are all the two major codes which we'll get for a denial. Okay, and what is 152? Okay, this also related, but it is related to the IP stay. When the patient is staying in the IP, and if it is exceeding the stay days, you will get this 152 denial. Mostly it is in the hospital stay. And 153, that is also related to your frequency. And B14, whenever you have the consultation, right, the second time consultation, if you're going to do, because you know very well Medicare or whatever may be the insurance, they will pay one consultation or one E&M visit per doctor. When it is going to be repeated, you will get this particular denial, COB14. Okay, these are all coding related. Okay, they need to fix it. Okay, there is a logic how we are going to fix these kind of denial. There is a website. I'll come back here to explain on it. So what we are going to do here is, first you check the denial and then confirm what denial category. Okay, out of this particular one, what we discussed, okay, is it related to 150, 51 or 53 and 54? Or if it is related to 152, okay, check this denial code and then verify how many units we build. See, mainly this denial is talk about, basically it's a frequency. For example, the unit is allowed only for 2 times per day, but you are billing third time on the day. So this will be the problem. Or sometime what happen now, if a Medicare, when the new enrollee is coming into Medicare, within 12 months they'll have some specific treatment. Okay, can be done. Okay, which is a preventive care treatment can be done, or the for example, the lab visit or lab checks. Okay, some treatment they had given a list of things. Okay, which can be done only one time within 12 months of their enrolling period. If you're going to repeat that, the same thing can be denied for a frequency again. So you should understand how many times you have to bill. So the MEU table is very, very important. Okay, so as I told you, this is the MEU table. You can go ahead and then download this particular MEU table here. There's a link. I'll attach it and then share it here in the WhatsApp group. You can download this. If you download this, it will come like this. And then in that, you can take a three things. One is facility and the practitioner and the DME. Okay, so this, if you download, okay, you will get this one like this. And there is a two type based on the CPT code. You will get two different category. So in that, what do you need to do? I'll take one code for an example to discuss on. For example, if you 71046, I took it as a sample. So this is the Excel sheet which you will get from the MEU table. In that, it will give very clear indication how many times you can build this particular code. Okay, this column B denotes how many times it's allowed. See, for example, as I told you, I'm taking this is a code which I'm referring to. So this code you can build 4 times a day. Okay, so if you are going to build anything extra than this 4, you're going to get denied for a frequency denial. It will be get denied as 150 or 151. So this is the denial pattern. So what you need to do whenever the denial is coming in, you're going to check in your MEU table. And if it is a correct denial, what do you need to do? You are going to, if it is an incorrect denial, send it back for reprocess. And if it is a correct denial, check the unit allowed and send the corrected claim and then move excess unit to the adjustment. This is the way we are going to work on this particular denial. So it's a very clear-cut division of a denial. It's based on the MEU table or medical policy. For example, if you go to UHC, they will have their own policy. How many units we can build. See, when I come to the lean way, what you're going to do here is the same thing. I just mark it down whether it is a VA or a NVA. Okay, so for example, if you consider checking and then confirming the denial category, it's a non-value add activity. And when it is coming to verify units in MU table, this is also non-value add. And denial itself is a non-value add, as we discussed. And when it is an incorrect denial, sending back for reprocess may be the value add work. And if it is a correct denial, checking the unit allowed and then send it back for the corrected claim. These are all NVA activities. See, now what we need to do to convert this into a NVA into a value add, we have to send all the feedback to the pre-billing audit. Whenever there is excess code is getting billed, we have to stop it here. That's the only way we can do this particular value add in this particular denial. The first point is when you identify this trend, stop it in the billing itself so that you will not get a denial. Right. So we'll come back here. If it is in radiology code, who are all worked in radiology code, you guys know about it. If it is done with the same doctor, we will use 76 modifier. And if it is with 77 modifier, if it is done with a different doctor. See, for example, I'm splitting like this. 2 units is done by the same doctor and 2 units done by the different doctor. This will get paid. For example, if it is going beyond your limit and you are going to bill one more unit additional, in that scenario, what we used to do, we used to bill with 59 modifier, which will not get paid. Okay, this will get denied for your 150 or 151. This is what it's going to happen. Okay, so whenever you get any type of billing here, you have to go back and then check how many MU is allowed, and based on the MUE, okay, it's going to be built. So as I told you, 4 units is allowed. When you are crossing 4 unit, and we'll try to build with 59 modifier, which will get denied as a 150. In that scenario, you have to go back and then move this for an adjustment because it is not going to be paid by the insurance company. So what you can do, you give a billing logic 71045 whenever it is crossing 4 unit. For example, give a logic if it is greater than 4, and then filter it, move back for review. Back to review. Okay, this is the way you can stop your pre-billing audit. Right? This is the way we are going to stop this particular denial into the valuable activity from the non-value add work. Okay, this is a very simple denial, but the thing is you have to do some research to understand how many units it is billed. It is allowed to bill. Okay, hope this will be helpful. We'll connect in the next week session with one more good topic on the denial side.